Welcome to Athletic Wise, where like-minded people come to connect. We focus on sports science and how it relates to the sports we love. In today's edition of the High Performance Speaker Series, we'll be discussing fascia. Fascia forms a complex collagenous network of connective tissue that allows synergistic function of bodily systems. Fascial integrity plays a massive role in sports performance and hence deserves significant attention in the field of sports science. Today's guest in the High Performance Speaker Series is Dr. Stephen Capobianco. Dr. Capobianco is one of the leading fascial specialists in the world. He is a practicing sports chiropractor, holds a diplomate in rehabilitation from the American Chiropractic Association, is an entrepreneur, and lectures worldwide on movement-based training and treatment systems. Dr. Capobianco is also co-founder and medical director of RockTape. He has taught hundreds of other doctors in the field of sports medicine, and we are honored to have him here today. So thanks, Dr. Capobianco.
My pleasure. Just please call me Steve. So I appreciate the introduction. It's always weird to listen to someone introduce you. It's almost like having someone sing happy birthday to you, just don't know what to do. But I do appreciate the intro and me being, let's set the stage when it comes to me being the expert, even though I'm highly interested and curious about this network of tissue that you just defined. I don't consider myself an expert. And in fact, if you talk to anyone in the Fascial Research Society, of which there is an organization that exists called the Fascial Research Society, none of them would tout themselves as experts, because we're all learning at the same rate of this new network that's existed, since the beginning, of how it affects both pain and function. So I think it's just a really fascinating time in our history to be able to start to learn about this network of tissue that I hope we get to discuss on this call.
Oh, that's great. That's great, Steve. I appreciate that. Yeah, it is a fascinating subject, and it absolutely is in its infancy. So I think you're on the leading edge of it, though. I really do. So
I'll take that.
In the research world, there's a pretty broad spectrum in terms of considering like what is actually fascia. We tend to think of large aponeuroses, but fascia also envelops skeletal muscles and other organs of the body. How do you think that changes the way we might view and treat other systems besides the musculoskeletal system?
Yeah, I think if we're talking of it in respect to the word you used in that description of how we'd use this knowledge in treating someone, I think a better understanding of how this network plays or has an interplay with movement and pain, I think it's critical to understand. So the evolution of our understanding of how this network of tissue that you described as enveloping muscles and other organs of the body, that's still a process of the dissection of this network of tissue. So what I quite often believe occurs, and this is something that an individual named David Lazondak says in several of his books, he talks about this dissective exploration of fascia leads to more dissective thinking of this network of tissue. And what he means by that is that over 500 years of anatomy, we've learned how to dissect the body into individual parts, and we've done that successfully. The problem with dissecting the body in that way is that we start to identify that the body is made up of these individual parts. And what I think fascia has done, or at least our understanding of fascia has done, is to say that there really isn't technically 600 muscles. There's really one muscle, but in 600 different compartments, as Thomas Myers, one of the leading researchers in this space, would say. So the reason that I bring that up is that our understanding of fascia as it stands now is much more encompassing than just a covering of the tissue. It is highly involved in the distribution of stress, which is involved with injury and performance, I should say. It's also involved in communication. So we generally believe communication is a matter of the nervous system, that we our nerve endings communicate to the central nervous system or the brain, and we have some type of output. But now we're starting to recognize that this fascial network, this covering that people describe it as, is highly involved in communication. So having a system that transmits force and communicates is becoming paramount in our understanding of how we can get people better, faster, and how we can make them better in performance. So that's where I think fascia, our understanding of fascia, is really leading to new and novel ways of treating as well as performing.
Oh, that's great. What about the term, I don't know if it's Tom Myers that initiated it, but that biotensegrity model, has that evolved since it was first proposed?
It sure has. The initial way of thinking of it would be more on the macro level. So the way that I learned it, and I'll speak to my own awareness of what the system was, is that it's almost like pulling the thread on a sweater. And if you give someone that analogy of pulling a thread on the sweater, if you keep pulling that, what happens to the actual fabric? And we start to see that pulling the thread at the shoulder, for example, could have an effect on the opposite side of the sweater. And that's where I believe this understanding of tensegrity or biotensegrity involving the human body has really been focusing its attention to say, on a macro level, what I do to my right shoulder can actually have an effect on my left hip all the way down to my left foot. And that is absolutely true. But to your point on the evolution of our understanding of biotensegrity is really now gone from a macro level of what I just described and moving all the way down to a micro level that we can influence cellular or DNA expression of proteins from influencing the outer body. So the way that I think of it as a manual therapist, someone that treats people with my hands, that I could potentially have an influence on how someone expresses a protein all the way down to the cellular level through touch. And so that to me is the evolution of our understanding of biotensegrity, is that everything matters. And if there's a way of making that connection from the outer body to our cellular selves, I think that part is, again, still in its infancy stages. Our understanding of this micro component of biotensegrity is going to change not only how we help someone when it comes to muscular skeletal health, but all the way down to how we potentially could treat things like cancer. And that's the stuff that just gets me excited, that there's an opportunity here with this new fascial science that we could really help a lot more people than just people that are injured.
So you're like literally scratching the surface at this point.
Absolutely. And it was exciting when we talked about the sweater. I'm not going to deny that me learning this idea that treating someone's left toe can actually potentially have an effect on their throwing shoulder. I think that was exciting at that time, but now taking it all the way down, what we can do to the cellular level because of how these tissues are connected is really, game changing.
Yeah, absolutely. And it's, I've seen it certainly in my practice working with my athletes, basically if they have a tight cervical spine, you actually can stretch the hamstrings and increase cervical range of motion. Yeah, so we
Sure.
see that, so many situations, I guess, working with athletes, whatever, if they have a dysfunctional SI joint, that it's a lateral glute, will have, hypertonicity in that contralateral lat. So we see it's very, very obvious mechanistically. So does this underscore the importance of fascia and understanding if and how muscle function becomes altered when adhesions form between adjacent fascial layers, whether as a result of injury or chronic inflammation?
Yeah, oh gosh, absolutely. What we're learning, and again, this is what makes it such an exciting field to focus attention on, is that what we're learning about the involvement of this network of tissue that encompasses the muscles that we usually focus our attention on, is that it influences the overall function of these muscles by distributing stress. And if the fascial layer cannot operate the way that it's intended to, it will redistribute stress in an abnormal way, which typically leads to these musculoskeletal presentations that we see. The one that I would stress, and again, me acting as the leading expert, I am not, but me pulling from experts in the field that are studying this, one that I would definitely share with your listeners is a researcher named Jan Wilks. And I might be butchering the last name. I believe it's a Danish researcher, but Jan has done some really interesting work of now starting to measure the forces within this fascial network, to your point earlier, that we can influence the ankle, for example, and see changes in the hamstring superior to that, all the way down to the cervical spine. And so to your point here is what Wilks and others are finding is that if this fascial system is not able to distribute that load, it will localize the stress to a specific region of the body, and then that leads to the specific symptoms that we experience. And so the one thing that we're starting to get consistent agreement on when it comes to the function of fascia is that we're talking about not just a singular layer of connective tissue that encompasses or that envelops these muscles, but it's multiple layers. In fact, typically it's 2 to 3, sometimes 4, depending on what area of the body, but we're talking about multiple sheets of connective tissue that should have the ability to slide and glide. And I'm not sure if you actually show video of all these, but what I do quite often to describe this to my patients is one hand over the other and demonstrate that these tissues, these layers of tissue, should have the ability to slide and glide. And when they can't, their ability to distribute force globally is diminished, and that leads to a local stress. So I believe it's critical for us to understand how to identify where these quote unquote restrictions are, and to how to influence them to improve their capacity to glide, so then we can better distribute force amongst the body in a biotensegritous, fashion. That's where biotensegrity to me really matters, because if you can't distribute the force along the entire system, biotensegrity doesn't matter. So that's the critical connection between fascial function and biotensegrity.
Mm-hmm. And that might lead to like premature degeneration of joints or IVDs potentially.
Yeah, another leading expert in this field would be the Stecco family, Stecco. Carla and Antonio are the two children of Luigi Stecco, who was the father of the fascial family, as it relates to that family, that created this program called fascial manipulation, of which there are textbooks and courses that you could take to really understand this network as a manual therapist. But Carla and Antonio have really talked about this inability for tissues to glide, leading to what I call the Velcro effect. So if tissues can't slide, two layers of tissue can't, they're Velcroed on top of each other. And since this network of tissue is so highly innervated by receptors, both mechanoreceptors that give us information of where we are in space, the proprioception, but also nociceptors, those danger signals that communicate to the brain that something is, there's a threat in the area, that when the tissues can't slide, there's a subsequent increase in stimulation of nociceptors, which leads to an increase in pain perception, potentially in this case. And if there's a lack of glide, there's less proprioception, less stimulation of these mechanoreceptors, so there's less awareness of where you are in space. Both of the nociception and mechanoreception, both of those have an influence on how you move. And I think that's the critical part. So would it say that fascial glide or fascial function directly leads to joint degeneration? No, but it definitely has a significant play in that process of degeneration, because if you don't know where you are in space, you will move abnormally. And if you have increased pain, you will compensate, and that typically loads other joints in the area. So that's the part where I think it's critical to understand.
Yeah, very interesting. And I I have this theory that, fascia has contractile properties in itself, perhaps not at the threshold to allow movement or stability, but yet it likely is above a threshold to influence neural coordination or activation. Do you have any thoughts on that?
That's such a good one, still. And I would be in the same camp of thought as you are, that it has an effect on neuronal function. Now, the evidence isn't necessarily supporting that yet, since we haven't spent the money to be able to evaluate, a limitation, going back to my description of a dysfunctional fascial system, the inability to mechanically slide and glide. How does that have an effect on proprioception and nociception? Could potentially lead to a compromise in neuronal function. I would say that would be accurate to theorize, albeit there isn't any specific evidence to suggest that there's a equals B type of scenario. But since we know that the fascial system distributes stress, we know that there's going to be an aberrant pattern developed when you can't distribute that load through these serial lines of connection. And so I know that there's an effect mechanically. I'm very confident that there's a compromise to the neuronal function of that athlete or that mover, but I can't say for certain right now. But the evidence is still to be presented, and there are people starting to look at that question.
Excellent. About the extracellular matrix, until recently, it's been primarily viewed as having a structural function, but more current research is showing it as basically a signaling network. So cells respond to the physical properties of their environment. Do you think that's all the more reason to strive for like fluidity in the fascia?
Yes, there's a couple things we should be discussing in respect to this idea of fluidity, going all the way down to the root word fluid. Is that we just recently, literally, there's a 2018 paper. Theis was one of the leading researchers, Neil Theis, Theis, I believe is how it's spelled. But the paper is looking at this new unrecognized organ that they apparently discovered, and it was coined to be called the interstitium. And the reason I bring this up is that as they were looking at biopsies of different tissues, the general way, and you know this, Syl, is the general way that we would look at these tissues would be processed in a specific way that would give us the image that we see through a microscope. And these pathologists that did this study would be looking at these tissues that we would identify as fascia, and they would be recognized, as I even describe with my hands, as these dense connective tissue layers. And that's what we identified as fascia as being. But with new technology and new ways of collecting these samples from living tissue, they've been able to figure out this new confocal technique that quickly freezes the tissue and preserves the tissue as it is in the body. And so when now you're looking at these tissues that we once thought were just layers of dense connective tissue, now we're seeing that it's a fluid network that resides within this lattice work of collagen. And the reason that this is important is that they're theorizing now that this connective tissue, this fascial tissue, is a fluid continuum that travels the entire body. And they believe that this fluid, which is, I guess, currently identified as pre-lymph, it's not necessarily lymph fluid, but it's pre-lymph, and it dumps into that system. But there might be a potential that it communicates globally through the body. So I might have rerouted the question into a specific answer that led to that this network is starting to be recognized as fluid filled, and the potential of transmitting information via this fluid network through this network of connective tissue. So I think this is so important. Going back to what I was talking about before, is that we've had an understanding of this system. Eastern science, Eastern medicine, I should say, has been talking about these connections, these pathways or channels within the body that the Western society really just didn't understand because we talked about chi flow running through the body. But I think this new way of looking at the fascial system as a continuum of fluid that potentially could travel and could connect the body globally is starting to give us an understanding of these quote unquote channels that we could potentially influence through traditional Western medical science. And I think we're at the only tipping point of understanding of how we can take advantage of this new knowledge to be able to help people from musculoskeletal pain to those that are dealing with more significant ailments.
And I do think influences like hormonal influences on the fascial tissue, certainly, that's new. And there's obviously, we see on a day-to-day basis, we see that influence. So yeah, very, very interesting. So it's obvious that we need to optimize that, that signaling system. So what is, in your opinion, the most beneficial way or the most effective way to optimize glide?
Well, I'm going to separate it into four things. You can influence it from the outside in. So we talked about that macro to micro. I think one of the things that athletes or anyone that wants to optimize their ability to move can influence this network of tissue through touch. And what we're learning from people like Stecco and others are demonstrating that the type of touch could be important to understand. So when it comes to tissues, we can apply a compressional force, which is probably most recognized. So that could be as simple as getting a massage from a manual therapist to doing a self-massage technique like a foam rolling tactic, to be able to create a compressional force to the tissue, which affects it both mechanically as well as neurologically by stimulating those receptors that we talked about. So that's the first way, is create. So the second force would be a lateral shear. And so I'm differentiating it from a downward force to the tissue to one that goes sideways, if you will. And the reason that this is important is that it has a different effect compared to compression, where it stimulates different receptors, in particular the Ruffini receptors, that has an effect on decreasing the tone of the tissue. But it also has the secondary mechanical effect that creates a plow response. Similar to a snow plow pushing snow, it collects that snow at that front end of the plow. The same thing happens when you create this lateral or sideways shear to tissue, is that we can create a plow effect of fluid that will move it out of an area, and then it will reinvest with new fluid, which has been shown to be very helpful in improving tissue glide. So compression and lateral shear, two mechanical ways of really affecting the quality of the glide and the ability for fascia to do what it's meant to do. And the last two are kind of complements of what I just talked about, is that by creating compression and lateral shear, we increase temperature of the tissue. That has also been shown to improve tissue glide or fascial glide. And then the last one is what we all should be doing, is once we mechanically manipulate the tissue, we should be moving it through what they call a triplanar fashion, in all the different directions that you have available to allow that fascial system to recognize that it can distribute the forces in all different directions that are necessary for movement. So the four are compression, sideways shear, temperature increase, and then movement, internal movement of the tissue.
Oh, that's excellent. Thanks for breaking it down that way. What about
Sure.
as far as taping? It's ubiquitous among high performance athletes. You see a lot of tape. So how do you think tape, as far as improving proprioception? We know it does, but how about for a healthy and non-injured athlete? Is it effective or?
Yeah, that's a great question. And I'm going to somewhat burst a bubble of people thinking that it can improve performance, and the evidence is pretty clear. And they've been trying to answer this question for decades now. I've been in the space for well over 15 years, and everyone in the research community is trying to answer, can a strip of tape improve your ability to jump higher, run faster? And the evidence is pretty clear that the answer is probably no. But I'm going to say that with a caveat, because what we're learning is that tape on the body, so we're talking about tape on the outside of this fascial system on your skin, can have an influence on your performance, but typically it kicks in once the system is compromised. So as an athlete, most athletes would suggest, would report that their injuries or their lack of performance typically happens later on when their system is fatigued. And that is true. The science supports that. What we're getting some evidence now is some research that are taking the typical subjects that they would measure, which are asymptomatic, uncompromised population, typically young college-age students are the subjects for most studies, and they would apply a strip of tape, and then they would look for some type of variable like, you know, a vertical jump, and they'd see no change in pre or post. But if you fatigued that cohort of subjects and then you reassess them, the application of tape in that category of those that are compromised has a significant benefit. So the point here is that the belief is starting to be supported that a strip of tape on the skin is probably most beneficial when someone is compromised, either through, you know, increased nociception or pain experience, or compromised in fatigue of the local tissue. So that's the part where I think is really exciting, that we can now demonstrate that tape is probably much more effective in the later stages of performance, which could potentially delay or attenuate the fatigue response.
Well, I think it certainly has its place then in sport. Absolutely.
Absolutely, absolutely.
Yeah. Well, thank you very much, Steve. I think that was phenomenal. Is there anything else that maybe I've missed that you'd like to add, you'd like to share?
Only another 3 hours of this discussion, but for today's purpose, I think I was able to share what was on the top of my mind as it relates to this topic. So I appreciate the opportunity and look forward to having more discussions in the future.
That's great. So if anyone would like any more information, they can go to www.athleticwise.com or Fascial Doc. They can reach out to Steve or RockTape, I'm sure, or all the many, many rock docs that you've taught yourself. But so thanks again, Steve. Really, really appreciate it.
My pleasure, Syl. Thanks again.